So I wasn't planning on making a video about penile fractures, but I just said, it would be too painful to watch or too painful to listen to. But I think it's good to do it because if you ever know somebody that eventually gets a penile fracture, you'll know what happened and you know what to do to help them out. So what is penile fracture? The name is sort of a little bit misleading because usually we think of fracture as something broken, like a bone is broken, and certainly the penis when it's in erection is definitely hard, almost as hard as a bone. So how can you break an erect penis? Well, it's not exactly broken. It's ruptured. They should have called it penile rupture. Basically, when the way this happens is when a man is in full erection, and then typically what happens is they're having intercourse with the woman on top, and then the pelvis of the woman is basically the bone against which this thing is going to come crashing and bending the penis the wrong way, and then there's so much pressure inside the penis, and there's nowhere for the blood to go, and then sort of in a flash. So then the corpora, which is the envelope of the penis, that tears, and when it tears, the blood comes gushing through, and the penis starts looking like, basically, they call it an eggplant sign, which is it's a big round eggplant that's actually purple. So it's usually a big swollen penis. And it's important to seek medical care rather quickly, not because you're going to die of this thing, but rather because there have been studies that show that repair within 24 hours has better outcomes than waiting. And the major risk of not having this thing get fixed is permanent erectile dysfunction. So, in order to get an erection, the blood has to come into the penis, and there's a mechanism through which the blood gets trapped into the penis, and there's such a high pressure inside this envelope of the connective tissue of the penis that the penis gets very, very rigid. Well, if there is a rupture in this envelope, well, you're never going to be able to get an erection again because the blood will leak anytime you have an erection. You will not be able to mount a high enough pressure in order to have an erection. So that's why it's important to fix it. If someone has permanent erectile dysfunction from a penile rupture, there is a solution to that, and it is the insertion of a penile prosthesis, which is it's basically, if you can imagine a bicycle tire, well, a penile prosthesis is basically the air chamber that's inside the bicycle tire. And if you put an air chamber inside a bicycle tire and inflate the air chamber, then the whole tire will be hard and rigid. And this is exactly what happens with a penile prosthesis. You're basically inserting a chamber of not air but water or saline, so there's a liquid, and this liquid, it's water, and the water is basically fills up the prosthetic, which is a small balloon, and because of this filling up, then the whole penis from the outside gets rigid because now there's something compressing it from the inside out, just like an air chamber compresses the bicycle tire from the inside out. That's how a penile prosthesis works. But we'll talk about penile prosthesis in a different video. For now, suffice it to say that penile fractures happen because of a tear in the envelope of the penis, the corpora, and the way to fix it is to to stitch up this tear, so that way it heals up and continues to be watertight, so that blood can be trapped inside at a high pressure.